One of the other things I found recently is the body brushing. It's Garshana and abhyanga. Garshana is the body brushing with a light body brush. You start at the arms, move towards the heart, start at the feet, everything moves towards the heart. It helps move the lymph, and the lymph doesn't have its own pump. If we have stagnant lymph, we have all sorts of problems. It can affect the brain, depression, muddled thinking. That's my problem, yeah. And you're not going to heal as fast because basically everything's a little dirty because the toxins aren't getting out of the system. Doing that, and then the abhyanga, and I'll be honest, I do the abhyanga more than I do the brushing. The abhyanga is the oiling of the body. And I didn't think that it made a difference to heat the oil up. It totally does. It's just yummy. But I'll pour hot water in the sink, let my oil sit in there, and then you're oiling like this on the long bones, like this around the joints. And I give a lot of attention to my low back because of the stenosis and the osteoarthritis and everything else. If a tissue gets dehydrated and kind of icky, like it's starting to get, what do they call that? They say this on my MRI, atrophy. The tissue starts to get atrophied. And getting that nutrition to it will help it heal faster. And it's difficult. Say you have a hamstring origin tear, which it's like right at your sit bone. It's a pain in the butt, literally. And it's really hard to heal because it's hard to get the circulation to there. So there are yogic things we can do to push the circulation closer to the attachment or the origin. But you start putting oil on there, you're getting the nutrition to somewhere quicker. And it's huge for everyone, I think, but especially those people with chronic pain, especially for cancer patients, to kind of help nourish the tissue and help push the toxins out after treatments. The other thing that has become one of my things that helps a lot, and I'm not going to say it works every time, but I had an instance where I came home on a Friday night and was in a lot of pain. It's like as the week goes on, I get less and less cheerful. No, I'm just kidding. But, you know, there's more cumulative. I haven't had the weekend of rest, and then I'm, you know, doing classes and going here and going there and blah, blah. So I get home on a Friday night, and I'm in a fair amount of pain. I would say probably an 8 or a 9. And there's something called yoga nidra, or it's a guided relaxation. There are all kinds of guided relaxations. I'm a huge fan of yoga nidra as taught by Richard Miller. And what it is a progressive relaxation. It's relaxing for this thing between our ears as well. But also there are little muscles, intrinsic muscles, that are kind of lace up the spine. And then there's all the spinal erectors that look like one big muscle, but they're really like spaghetti strings coming down the back. And if those start to get lopsided, some are tense, some aren't, all of that can start to create problems. And who here is a master relaxer? Yeah, right? You know, so listening to that guided relaxation, and this one particular night I came home and I put that on, and it takes me a while. For me, if I lie flat, especially if I'm in acute pain, I'll just sit there and tremble because I'll start spazzing, like spasming or spazzing. So I put a couple pillows, lay there, and by the end of that, it was a half an hour meditation. By the end of that, I was totally pain-free. It was amazing. I was like, okay, note to self, this stuff works. And a week ago Friday, I came home and it didn't touch it. So it's how much we let ourselves get out of balance before we can get back into balance. But those kinds of things, giving ourselves that time to just slow down, deepen the breath, and I'll do where I breathe as though my lung is where the pain is. Sometimes that works. Sometimes deepening the breath makes the pain a little worse. And sometimes the pain is worse for 10 breaths and then it starts to subside. So it's kind of an ongoing thing to see what works for you. If someone has, that being said, you're coming off an injury, so we're going to baby it. But generally speaking, lumbar discs, any disc, all the discs are the same. It's just what section of the spine they're in. They're going to be bigger at the base, smaller at the top. The vertebral bodies are very similar, and they just grow as we get down towards the bottom. This is a riskier area of the spine because we have so much mobility, which is awesome. But anytime you have mobility, there's less stability. At the lumbar, there's a lot more stability, but still a fair amount of mobility and rotation. The thoracic spine, if we didn't have the rib cage, would be like, whoa, it could spin all over the place. Luckily, we have the rib cage. It's rarer for there to be disc damage in the thoracic spine, just because of that lack of mobility. However, car accidents, skateboarding, surfing, motorcycle accidents, or the all-time favorite, degenerative disc disease. And that is systemic. That affects kind of all the discs equally. And for me, because I have it, and I have students with it that are 20 or 30 years older than me, so I'm always watching them, learning from them, and then noting what to do. But this sort of thing, if you have degenerative disc disease, I'm just degenerating them more because I'm adding compression. That's why you want this sort of elongation. And letting the more we can stack our bones, the better. Meaning, this is not stacked. This is stacked. So we have the spinal curves that help dispel the weight or disperse the weight, but as much as we can be here, that's better. Because as we do this, all the weight's going to start to transfer and it's going to put a much bigger load on the back. So if someone has disc damage, if a disc is bulging, it can retract. I'm going to say that again. If a disc is bulging, it can retract. Partly because I have a woman who came to my class Friday, and I know I've said it before, but I've never said it before when she was in the room. And she's a nurse, has been a nurse for 30 or 40 years. And she goes, in all my time nursing, no one's ever told me that. A bulging disc is, it's just starting to push through. So if you think of how the spine moves, if I go into a back bend, the disc is going to move forward. So the nucleus of the disc starts to come forward. If I go to one side, it will go to the opposite side. If I go forward, it will push back. That's why people, generally speaking, a disc will bulge to one side or the other. I met a woman one time, she was one of my yoga teachers actually, and years later after I had a lot more training, I bumped into her, and she goes, you know, I blew one of my lumbar discs and it blew forward. She didn't have to tell me what she did. She was an Anusara teacher. Wild thing, all these really big back bends, compressing the discs, pushing them forward. Now, if I'm laying here, this is the other thing that's ironic to me. The riskiest pose for your low back is when you're seated. Doing this multiplies it by 10. Because if I go into a forward bend and I have tight hamstrings, it's going to pull me back. The floor is not going to move. What's going to take the heat is my discs or my muscles or my bones in my spine. So you don't necessarily want fixed hips when you're working with maladies in the low back. However, if you're doing back bends, and I learned this, sorry Bill, with a client, he could not lie on his stomach, and he had had a laminectomy, lumbar scoliosis, and quite a bit of issues. And at the time I met him, he was in his upper 70s. Laying on his stomach on the floor hurt. So I thought, okay, well, we'll do a back bend at the wall. I'll have him stand near the wall, inhale, lengthen, and go into a back bend. Well, that lack of stability here annoyed his back. because he was kind of, torquing the back a little. So that I always find interesting, and I think it's because we have this soft spot here. The hips are going to be more stable, but we still have some give in the belly. But these sorts of things, inhaling, coming up, using the strength of your back, exhaling down, that will gently start to encourage a protruded disc back into where it belongs. If a disc has blown, meaning, and there's so many terms, slip disc, blown disc, bulging disc, herniated disc, la 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 la, and it changes every 2.5 minutes. And I have to be honest with you, a lot of doctors I know don't know the difference between them. And so then they're telling their patients, and their patients sure as hell don't know, and so they're coming to you. That's why I like to see someone's MRI so I can see the exact terminology that was used so that I know precisely what's going on.
When you said coming up and going back down was the best thing to make it go back from being protruding, what kind of an asana or what kind of a move are you talking about? I mean, are you talking about bridge?
Thank you, that's a really good question. So a prone back bend is this. Bridge is my second go-to. So the question is, what kind of a yoga pose would be the ones that would get the discs to retract back in? Gentle, repetitive back bends that are prone. So a repetitive cobra. And I don't teach cobra where you're using your hands and pushing way up into like a cobra, but where you're lying on your stomach. I'll even have people take their arms out to the sides. Inhale, lift up, exhale down, so that you're making the erectors in the spine work. So that is the best one for the retraction. The retractor. Okay. Sorry, that's from the Big Bang Theory. Okay. Then one of the other awesome poses is, I call it rolling bridge just because people understand it more. In my tradition, it's called Dvipadapitam, and it means two-footed pose. It's a very fancy name. And that one is peeling the spine up 1 vertebra at a time and rolling it back down 1 vertebra at a time. And if I'm in acute pain and I try and do this, it's going to be ugly, because I'm pushing up into a back bend. So feet hip width apart. I've started teaching this always moving on exhale, where you inhale. It's much easier to engage the core as you exhale. Peel the tailbone up, maybe peel the mid back up. This is fine. If this is where someone can go to, great. And then rolling back down on the exhale. Sometimes it might be that you push all the way up. But if that creates pain, we're not here to hurt you, as much as some of you guys think that that's my main goal. So the rolling bridge is also really good.
Related. What if you come a little bit up, then you hit pain, but if you pass that pain, you can go all the way up. What should you do? Because it doesn't hurt when you're up.
That's a really good question. So the question is, so if you're doing rolling bridge and it hurts partway up, but then if you go past that, is it good to go? And I'm going to have to pull the Vinny Yoga answer of the year out. It depends. It depends on how acute that pain is as you're passing it. And I would say roll to it and come down. Do that for 6 or 7 repetitions and then go up and see if that makes a difference. Or do it just going to that point for 6 or 7 days and then try to see what works best for you.
Okay.
Yeah. But I get that sometimes too, where it's fine to a point. Yeah, it's like, nah, and then you're okay.
Just pass it.
Yeah.
Okay.
Yeah. Okay.
Justine, can I digress a little bit before I forget?
You can digress all you want.
Comment please on full body massage regularly. Is that along the lines of the body brushing, the oil?
Yeah. So
What kind of massage? There are many kinds.
so the question is, I'm gonna have fun with this one. The question is, how about full body massage? What would be the best body massage? And then how does that relate to the oiling? I had a lot of resistance to that daily practice of the oiling because, and even when I started doing it, hurry, hurry, fast, fast. And I was in a training when we were doing it on Ayurveda, and we went back and did a check-in one night, and these women were sharing, oh my God, it was just so nice to have that time with me, and I felt so nurtured and I literally started crying. I'm like, I'm not worth 10 minutes to take the time to actually massage, you know? So I'm gonna encourage to do that because it's a daily thing you can do. And I'm gonna say, if it's that you can start with massage, just doing here, say your backs and your hip, if you just start there, you can work your way into incorporating it. And massage rules. I mean, I think
But it's expensive.
it's expensive, and I would say varying up what kind of massage you get, and there can be very therapeutic massages, and then there's more of the feel-good massages. The feel-good massages are awesome and they feel good. They don't necessarily affect lasting change in the body. We get that more with what we do ourselves, or it's interesting because I asked my craniosacral practitioner who's also an osteopath. So I saw him twice this week in my week of trying not to be broken. That's what I'll call it from now on, my week of trying not to be broken. And he asked me on Tuesday, he's like, so what are you gonna do for the rest of the week? And I said, well, I'm torn. I could do acupuncture. There's someone I know who does like therapeutic medical massage, who I still really want to try. Or one of my yoga therapy students does this thing, it's a kind of wand where it releases the lymph. And he goes, well, massage doesn't really affect lasting change. Acupuncture's nice, but craniosacral is also more of an energy work. So it's a totally different approach, but that close together probably wouldn't be as good of a change. And he goes, I'm really intrigued by the lymph. So I couldn't get in this week. I'm going this coming Thursday, so I will let you know how the lymph goes. I had a massage once called Lomi Lomi, where it's a Hawaiian one, and the idea is you're not just nourishing here, the skin, you're nourishing the muscle down to the bone tissue. And they're like grinding this warm coconut oil into you. It's awesome, you know, and my friend did it for me. And afterwards he goes, okay, this is really weird, because normally when people get off, they have like special coverings for their massage table that's kind of plastic so that you kind of slip and slide on it. My skin sucked it all in. There was hardly any left on the table. He's like, really? You know? So I think sometimes we need those deeper nourishments. And my husband gave me his shiatsu appointment on Thursday. That's good too, because you're working with, you know, pressure points, but also fascial adhesions. And when my back went out so bad, scary bad, and the fascia was pulling everything to the back and pulling things off to one side, I laid on my stomach. It took me about 10 minutes to get there, because it's not easy for me to do that with like stuff piled up under me. But he did like fascial adhesion point releases. So he's got his finger in my on my sitting bone and then kind of mid glute and squeezing and releasing. And it's not comfortable, but it releases it. If you release the fascia, does everyone know what fascia is? It's fascinating. Yeah? I mean, just a much denser tissue. So, and it's through our whole body. And there's stuff called the deep front line. So you could have pain in your knee and feeling it in your psoas because of that fascial connection. If we can release that, it just kind of catapults us quickly towards healing, if that makes sense. So my answer, I think, would be massage good, self-care better. You know?
Would you comment on like Tai Chi and Qigong, would you, the tapping?
So the question is commenting on Tai Chi and Qigong and the body tapping. I'll start with, I don't know a ton about it. I mean, I've done some. I think it's awesome, and I think even some of the different points they tap, like I'll have people tap here a lot because it's good for the immune system, it's good for anxiety. And one thing I've learned, and that's kind of what I was alluding to earlier, that my Vini yoga wasn't working for me, so I brought in Feldenkrais, I brought in cranial sacral, that sort of thing. There are so many amazing healing modalities that I think taste test and see what resonates with you. But I definitely think there's value to that, and I'm big on shaking the lymph as well. Standing and shaking, laying on your back and shaking, anything to get the lymph moving. Partly because I had he was a chiropractor, but he's also an Ayurvedic doctor. Years ago tell me, he's like, everyone has stagnant lymph. And the medical world, the Western medical world, didn't talk about lymph until probably about 15 years ago. And it's a huge part of our healing, and it's a trash system. So if you can't get rid of the toxins, that's a problem. Yeah.